I'm Susan Mahero. I work for Nairobi City County. I'm the head of epidemiology and disease control. And I also work at the Emergency Operations Center as the operations manager. So it was hectic, but that was one of the strategies that the country adopted. The lockdowns, it started with Nairobi and quickly to other counties that were also reporting many cases. So we also had isolation of cases and quarantine, and schools were being used as quarantine centers. These were people who were exposed but did not have symptoms. We took them to the quarantine centers. So during that time, we used schools, we used colleges like KMTC, where these people were taken. We had isolation centers where those who had symptoms were being taken. And we also had isolations where we were taking people who were confirmed COVID cases. So these were also a few hospitals that had capacity to take care of these patients. Remember, they required oxygen that was not also easy to access, and the numbers were overwhelming. The government had put a waiver on those services. Initially, they were getting free treatment. Later on, that was lifted, and the patients would take care of their own health care. Again, that was not easy for us because remember, we had informed them that once you are taken for isolation, the government would take care. Soon we were changing the story and telling them you are going to take care of your own health. It was not easy. We also had contact tracing as one of the strategies that we are using to get these patients early and monitor them and manage before the cases would escalate. Contact tracing was good. It had a few challenges because it is a labor-intensive activity. It requires a lot of resources because you need to call, you need to take care of airtime for those who are doing that work, and you need to do it real time so that you get this patient. On the other hand, it helped our patients. It was very good for us because we had one-on-one contact with these contacts. They could get clarifications from us, from the healthcare workers. This was being done by surveillance officers, and they could get information about this disease. They could ask questions and get assisted. Again, if anyone developed symptoms, they had somebody to call back for assistance. And many a time they would call even at night that I've started developing the symptoms, what do I do? So then we needed to evacuate them. And because our EOC was operational that time, we would easily get ambulances from the EOC, this is our EOC, to help evacuate them and manage those cases. Remember, now we had contacts, we know where they're coming from, we have their phone numbers, so we would follow up. And we had a database, a line list of all these cases, those who developed symptoms, what is the outcome. So it helped us track these cases, it helped us track the contacts and manage them. So we also needed to get case management for these cases. Who is managing them? So case management was important. We needed to get the medical practitioners on board so that these cases would be managed adequately. And that was being done in our major facilities because these patients required oxygen. Some facilities were not able to provide that, so Mbagathi was one of our sites. Mama Lucy had an isolation ward for them. We also had KUTRH the KU referral hospital that was also isolating the patients. And Aga Khan, so there was a lot of public-private partnerships that helped manage these patients. There were a few experiences during that time. There were people who were not happy being followed up, even after explaining to them why you needed to be followed up so that we know what was going on. And many a time they would tell you they don't want to be followed up. But after a few days, they call back themselves telling you now, I need your help. Please forgive me for not allowing you to interview me. So kindly assist me. And I think professionalism came in. Those were some of the lessons that we learned, that you would not turn away such a patient. You still needed to take care of them, support them, ensure they got the assistance that they required. And it brought people together. There was a lot of consultation because this was a new disease. Many people did not understand it, so you needed to consult widely with other colleagues just to know what to do. And we also kept in touch with the national. We had WHO colleagues who are working with us. So we were consulting a lot. It brought many partners together so that these cases could be managed well. We also had a lot of issues with burnout. There were no leaves. People are working throughout. And a year passed by, you are still working. Another year was coming in, the pandemic was still on. So there was a lot of burnout, especially among the healthcare workers, among those who are collecting this data, the surveillance officers. They are always on it every day and producing daily situation reports that were being shared widely. So it was not easy, but it brought a few goodies with it. If you go to Mbagathi, you'll find an isolation center, a big tent that was built there by the World Bank that was meant for COVID isolation. That tent is being used to date. Currently, it is our CTU cholera treatment unit. So we are able to isolate patients in that unit, which would now be posing several challenges where to take them. Remember, again, during such epidemics, you get very large numbers of patients and you lack where to isolate them. So that tent is still there. It is working well for us. It is one of our big CTUs currently in the county. So I think COVID has also taught us a lot of resilience, because now not just like the other epidemics that were being managed, maybe you find a few people are not even aware there's cholera, a few people are not aware, anthrax is there. But now this one was an eye opener, because the health structure was overstretched. People got to know that these epidemics can get out of hand, and a lot of life was lost during that time. And a lot of supervision was required for burial. And this brought many people together, because even the community now needed the healthcare workers to support them, even during the burials. And now the working relationships with the communities improved, because now they realized we need one another. For any disease to be controlled, the community must be involved. The healthcare system must be robust and we must work together to control those epidemics. So we have had a lot of community members getting interested. If they get to hear of Ebola, they call and ask, because they know if you hear about a disease just in another country, it could get to you very fast. So they call, make inquiries about that disease, and we are able to talk and share information and also demystify some of the myths that are running around. So again, because of COVID, we have been able to sustain the EOC because it came in during the COVID time. It has continued to be there coordinating epidemics, and now the EOC is running because of COVID. This is the Emergency Operations Center, where we have those receiving calls, asking anything they want to ask about any emergency, and our number is 1508. So we shared that number widely, so anything that you need to inquire, you call the EOC number. So it works 24/7. So Nairobi is one of the counties with an operational EOC, Emergency Operations Center. I was lucky to be part of the national coordination team. It was called NMAC. That was a very powerful center. It was being coordinated by KDF. So you would work odd times. You would go to very risky places. Remember, we had the high end. One unique thing with the COVID was that most of these cases were coming from the high-end estate. Lang'ata was leading, Westlands, as opposed to Mathare, where you're looking at the nature of the disease, you would think the transmission would be very fast. But again, perhaps it is because of testing. Maybe Mathare were not going for testing, but those who needed to travel, those who needed to know their status, are those who fly out. So maybe that's why those areas had high numbers. A few healthcare workers got infected. I think we lost a few. And a few were sustained. We thank God.